Okay, so, okay, just the left side. Sure thing. So let me see. So it does say that, you've tried chiropractic care before? Yeah, I've been to, never for my neck. I went to, Clark, I've been to Clark. Oh, okay, Clark. Chiropractic, yes. Been to Dr. Davidson. Okay, so you're.
Okay. Now, Matthew, what personality is he?
He's a melancholic
Okay.
with the touch of sanguine.
Yeah, he's definitely not passive phlegmatic, is he?
No, he's not.
He definitely has some control about him, doesn't he? He's got some confrontation and control, doesn't he?
He does.
Okay. And he's a male.
Correct.
And it sounds like he's in his 40s.
Yes, yeah, he is.
Okay. So you got a tough patient. You got a male in their 40s who's more under control. He sounds a little more like a choleric than a melancholy to me, but so now they know how to make decisions, but you can't beat around the bush with these kind of people, right?
That's right.
Do you understand this?
Yes.
Did you watch the videos on understanding personalities?
Yes, I did. So with the choleric, you want to just give them the control, and then they can do whatever they want with the information.
You better be straight and to the point and not lollygag around.
From the area. Yeah, I'm from here. Oh, okay. Awesome. Me too. Okay. Yeah. Cool. Sweet. So it says here, 7 out of 10. That's pretty severe. It's pretty rough. Yeah. Severe. I even left work today and I went home and tried to lay down a little bit and I can't lay down. I mean, I can feel it. Like when I lay down, I can feel it throbbing. That's throbbing pain. Okay. Yeah. It says here it's numbness, tingling, sharp. And I'm gonna add some throbbing in there as well. So it goes down to the shoulder, which you did show me. You said it was irregular and daily. Is it more? Did you feel it more?
Okay. So you're having them fill it out first, right?
Correct.
Okay,
Yes.
that's good. So that's going to save you a lot of time. And now you're just checking them off, right?
Yes.
Okay. Now I didn't hear anything in the beginning, so I didn't know if you did any bonding and rapport. I don't know if he did say he'd been to a chiropractor before, okay. And I didn't hear any third party connection. You didn't cover that, did you?
So with the bonding and rapport, would it be enough to just say, "Hey, I'm from the area as well"? Since we've grown up in the same town.
Well, he doesn't care about you.
Mm-mm.
So just follow the line of questioning with bonding and rapport, or how did you hear about it? Remember, the very first question you're asking is, how'd you hear about us? Because
he heard from us from a Google or web search.
okay. Now you need to keep track of that because you're going to be evaluating your return on investment. You're going to be finding out what works, what doesn't. And when he did a Google search, guess what the next word out of your mouth should have been? Can you hear me, man?
Yeah, I can hear you. Is it another question or like
Yeah, that was a question.
No, but should I ask him a different question? As soon as he said, "Yeah, I got you from a web search."
And then the very next word out of very next statement out of your mouth should have been what?
Did you have any friends or family that come here to the clinic as well?
No. What did he search? You don't have a clue. You don't have a clue what words he searched for. He just said search, right?
Yes, he did. That makes
What words did he search, Matthew?
I didn't ask.
You don't know because you didn't ask, right?
I did not.
So how are you going to know what key words you need to be paying attention to for SEO or Google or your pay-per-clicks? How are you going to know?
I wouldn't.
Do you understand? You need to find out specifically what they're searching when they say, oh, I found you on Google. That's not good enough. Do you understand this?
I understand.
So when they go, I found you on, how'd you hear about us? Oh, I Googled you. The next word out of mouth, if you don't mind me asking, what words did you search for? You need to find out the words, and then you better write them down. You've got to keep track of these words for SEO purposes, search engine optimization purposes. And if you're ever going to do any pay-per-click with Google or Facebook, you better damn well know the words people are searching. Does that make sense?
Yes.
Okay. All right. So this should go pretty good since he wrote it down. Now, the other thing we did not hear in the beginning because the recording was so bad is I did not hear you cover all the different complaints. Did you cover all the different complaints with him?
Yes, I did. He was only coming in for his neck and
Okay.
shoulder.
Okay. All right. So now you're going through the OPPQST, and you should just nail that down because you see how much faster it goes when it's already written down, Matt?
Yes, it's a lot better.
Okay.
In the morning or in the afternoon?
Right now it's
Constant. Okay.
Yeah, like I said, I went home early today, like at 11, and I took 3 Advils or 3 Tylenols. And I mean, it's been hurting for like a week, but not like this. Today, it's just like really pain. I mean, I can really deal with the pain, but
Yeah.
today it's just something different.
A lot worse. Yeah, it does say here that you said that you slept.
And Matt, I hear you keep saying, it does say here. Do you know how many times I've heard you say that now?
I use that statement to try to get back on track to what he said on the paper.
But you don't need to say it does say here. Just say it.
Okay.
It's almost, Matt, it's almost like me meeting you and go, let me tell you my name. My name's Paul. I don't need to tell you, let me tell you my name. I just need to say, hey, my name's Paul. Just say it. Just read it. You don't have to tell them, I'm going to read it. You got my point?
Yes, that's fine. I get your point.
You don't got to tell them. It says here, it said, no, screw that. Just say it. I see you have this. I see you have this. And you have this, and you have this, and you have. That's what it would sound like. Not, it says here, it says here, it says here. He already knows what the hell it says. He filled it out.
Wrong, and it was a week ago.
Yeah, it's been about a week. I mean, but it hasn't been this much. I mean,
Yes. Is this the first time you've had this neck pain before? Have you had any prior pain to a week ago in your neck?
well, in my shoulder blade where I was pointing, and I always get it on. I always have my wife just,
Now, remember, when somebody says a week, you always want to know what was the mechanism. What happened a week ago? That should have been the next question. What happened a week ago? Did you have an act? And if they don't know, then you do a menu. Did you have an accident, an injury, a fall? Can you remember anything? Okay. And then go back. After you have the mechanism of injury, then go, now prior to a week ago, did you have any neck pain at all? And then you just keep doing that until you ask the question, prior to that time point, did you have any neck pain? And they go, no. Now you have your starting point of the problem. That's how you get it. You keep going back. Remember, 50% of the time, when the patients tell you that the problem, whatever date they tell you it started, it did not start on that date. Then why don't they tell you? Because that's the date of their consciousness level. When you actually dig and you go, well, prior to 3 months, have you ever had any neck pain? 50% of the time you're going to hear, well, yeah, just a little, or yeah. In other words, you're going to rise it to the surface. And then, and this is what it sounds like. So prior to a week ago, did you have any neck pain at all? No. And then you always go to a second resistance. So prior to a week ago, you didn't have any neck pain at all? Well, yeah, I had a little bit of neck pain. That's what it sounds like. And then you go back, then you got to go when? Well, when you did have a little bit of neck pain, how far back was that? Was that like a month, 6 months, a year, just roughly? Oh, maybe a year. So about a year. What happened a year ago? Did you have an accident, injury, fall, anything? No. Well, how about prior to a year ago? Have you had any neck pain? Well, yeah, just a little. Well, how long have you had it prior to a year ago? 1 year, 5 years, 10 years, just roughly. Well, probably 5 years. Well, what happened 5 years ago? Did you have an accident, an injury, a fall? No. Yeah, I had an auto accident 5 years ago. Well, let me ask you this. Prior to 5 years ago, did you ever have any neck pain whatsoever? No. So prior to 5 years ago, your neck was 100% healthy. You didn't have any problems whatsoever. Is that right? Right. That's what it sounds like. You can expect that from 50% of your patients. But if you don't know to do that, they're just going to give you the consciousness level. In other words, when did the reexacerbation start? I guarantee you, this problem has been going on with this guy more than a week ago, unless he had trauma a week ago. He's just telling you a week ago because that's what's on his consciousness level for his reexacerbation. You need to understand what I just said. They don't tell you. They tell you the reexacerbation of an injury because that's what's high on their consciousness level. And that's how you find it out. You ask again. You go past that time. So prior to that, you keep going past the time they give you until they say, no, my neck was totally normal. That's how you find the real. And then remember, you always want to anchor it. How did it happen? If they don't know, menu it. And if they still don't know, anchor it to nothing. So basically it happened a year ago, but you don't know how it started. Is that right? I just anchored it to nothing. Okay. But you always want to try to anchor it. Why? Because it increases the awareness of the problem. That's why we want to anchor it. And by the way, clinically, it's important for you to know because that's going to tell you how much that problem's already healed to some degree. And that's most patients. Most patients come to a chiropractor, not from the origination of the problem. It's from a reexacerbation of a previous problem. What does that mean? They've healed wrong to some degree already. That's what that means clinically.
A little massage or whatever, but yeah, I get it right there. But as far as the neck pain, not like this.
Not like this. Okay, for that shoulder, because it seems like it's related. With the shoulder, what happened to cause that?
I don't know. It's just been like, I mean.
Well, now, Matt, you're on a different topic now. Now you're talking about a shoulder. So now you're confusing me, Matt.
Yeah, no, I said shoulder, but I pointed to my neck, but I totally understand that it was confusing with the words I used.
So are you telling me you're still on the same topic?
Yes, because with that I was pointing to the neck, but I said shoulder, and I was trying to get the mechanism of injury. When I asked, well, what happened with it?
You got to use, I mean, I don't need to tell you, you need to use the right words. I don't need to tell you that, do I?
No, you don't.
You got to step up your communication skills, Matt. You got to pay a lot more attention to what's going on with communication. He says it's neck. You should be saying neck, not shoulder.
It's not like an everyday thing. It's reoccurring. I mean, every now and then it just keeps popping up.
Okay, but it wasn't related to a car accident or fall.
No, nothing like that.
Okay. Okay, so you don't know exactly when it happened. It just kind of came up. How long ago did you notice it?
Probably about a week ago. Like I said, I could feel it.
I'm still real cautious. A week ago, I mean, there's some bullshit going on here. He's had it a week ago, and you're telling me he doesn't remember how it started at all, and he never had any neck pain whatsoever prior. That's bullshit. Something happened. And if nothing happened, it's a reexacerbation from a previous problem. We don't just have problems start for no reason at all, unless it's cancer. You know, we're dealing with micro and major traumas. That's what we deal with. So something's not right here.
When I turn like that, I feel a little pinch or something there. Yeah, last night I was watching TV and I could feel it like coming on even more. So this morning when I woke up, I was like, man, it was rough.
Okay.
Yeah.
Okay.
It's just, yeah, I could feel it when I.
Now he's taking off on you, so you now know he has the ability to take off on you. So you got to get in control of this thing and get moving.
When I go like that.
We don't want him to tell us 20 different times that he feels neck pain, okay? We don't need to hear it 20 different times. So you got to take control of this thing. And remember, pauses. When you pause, that allows for runners to run. And that's what's happening with him. You're pausing, and he's just taking off on you.
Okay. So with that.
And by the way, Matt, stop saying okay when they start telling you they have a problem. What you should be saying is that's not good or that's not okay. That's what you should be saying. Not okay. That's just totally incongruent. Doesn't even make sense. You know, my arm's bleeding. It's gushing out of my artery. Okay, next question. It doesn't even make sense. Okay, and you're okaying them. So when people have a problem, you know, you got to be a little sympathetic to them. You can't just, okay, that sounds like just a damn data collector. Okay, next question. Okay, next question. There's no bonding and rapport there. So when they tell you a problem, respond accordingly. That's not good. That's what you should be saying. Well, that's not okay. That's not good. And, you know, and it should be relative to the magnitude of which he's saying it. So obviously don't overplay it.
Pulling, is that why you said yes, having difficulty at work?
Yeah.
And that's what you're doing for work?
I sit in an office now. I used to be on the field.
See how he's taking off on you, man?
Now I'm an office guy, so I'm sitting in front of the computer just, I know.
So when they take off on you, what do you have to do? You got to stop them and you got to train them. He's real close to needing to be trained right now. Because he just takes off. He's not even paying attention to your question. He just takes off and says what the hell he wants to say.
That's probably one of the reasons, as far as not moving as much as I should. That just being stiff, just typing all day.
He's just taking off on you, Matt.
Okay. So it says yes, to the left. So turning to the left is what's giving you a lot of issue.
Yeah, if I turn like that right there, I can feel it. If I turn my neck that way,
even worse, just left, bending really worse. Okay, so that's what's making it 7 out of 10. You said yes to sleeping on your stomach, left and right side, also 7 out of 10.
That's not was pretty rough. I try to sleep on my back, and on my left side, and then on.
See, he even is interrupting you. He interrupted you just to keep talking. Now, I'm going to let somebody keep talking. If they're answering a question that I'm going to ask in the future, then I'll let them talk and I'll just make sure I write, make a notation of it. But that's not typically what patients do. Typically, patients just ramble.
Actually, I'm all right side.
Okay.
And then the one mistake you don't want to do, you probably won't do it because you have it written down. If you didn't have this written down, I guarantee you this would happen. You're on OPPCRST, and then he accidentally brings in an ADL. He starts talking about sleep. And instead of you finishing the OPPCRST, you heard sleep and you're going to ask about sleep. So you totally go and start asking them about sleep now. That's a common mistake. is you chase something because you know you're eventually going to go there. And so if they say it, you just, it's like a dog that sees a rabbit. Everything around, he forgets everything around him. He just chases the rabbit now. That's what happens when you're not trained, when you have terrible active listening skills. That's what happens. Now, since you wrote this down and you've got it in front of you, that alone is going to help you keep the discipline of not chasing rabbits.
Yeah, sure.
We shouldn't go to his sleep right now, even though we're going to go there. I still need answers to my questions, damn it. Because remember, we're covering one topic at a time and we're done with it. We're done with it. We're not jumping around. We're going to nail the damn topic, go to the next one. We're going to nail it, go to the next one. We're going to nail it. We're not going to jump our ass around.
Right here about that. And sleep's important. Okay. And you're also having troubles bathing, showering.
There you go. You jumped. You jumped. There's your rabbit. Rabbit came out of the hole and Matthew jumps. You didn't even answer your questions of OPPQST. He brings up sleep and there you go. You jump.
Yeah, I mean,
Yes.
like I said, just trying to watch myself.
And then he takes off on you. You should be training him. What does that mean, Matt? You should stop. You got to stop. And then you got to let him know what's going on. Hey, whatever, forget his first name. Hey, let me be real specific. What I need to do is ask some very specific questions to see what's going on, see what the problem is. So let's be real specific with our answers. That'll help us understand what's going on, okay? You got to create the awareness. You got to stop the chaos. Who's going to stop the chaos if you don't? He's not. He's the chaos machine.
Just trying to raise my arms up and stuff. Yeah, definitely doing this right here.
Also 7 out of 10. Okay. And then there's no pain with cooking, cleaning, laundry. No, none gardening.
My wife does all that.
Okay. Right. So
So remember, with men with ADLs, where do you focus? Work, hobbies. That's where the focus is with men. Work, hobbies. Work, and it can be sleep. Work, hobby, sleep. But work definitely with men. Hobbies definitely with men. Okay? I already know I'm not going to pay much attention to cooking, cleaning, and laundry to a man. Okay? That's where the emphasis should be. That's what you should be finding with a man. It's definitely work. Men pay a lot of attention to work and being a breadwinner. So what you should be getting is going through all the ADLs, yeses or nos. After you get the ADLs and then what ADLs are positive, then you should be finding the primary ADL. That's the single most important topic you're going to get of the day of the consultation. What is the number one ADL? How is it quantified? And what plane of motion? That's what they're paying for. You've got to find it. You've got to get that agreement with him that this is it. And then that's what you're going to use in all of your patient education. That's what personalizes the patient education instead of just gobbledygook.
out of the working, sleeping, and bathing and showering, which one do you want to get better the quickest?
Just sitting here, like,
Okay, Matt, I want you to write this down. I need you to write this down. Which one's bothering you the most? You'd like to get better. You'd like to get pain-free the fastest. Which one is bothering you the most? You'd like to get pain-free the fastest. It's a bilateral question. It's not a unilateral question. Unilateral is which one's bothering you the most. That's unilateral. bilateral. Which one's bothering you the most? You'd like to get pain-free the fastest. That's how you want to ask that question. By the way, that's the same question you ask when they have multiple ADF, when they have multiple complaints, right? When they got more than one chief complaint, they got 2 or 3, then you stop and you ask them, which one's bothering you the most? You'd like to get pain-free the fastest. You need to know which one is most important to them. And that's where you're going to spend 80%, 70 to 80% of your time and energy, not on a secondary, tertiary complaint.
If ask that, Paul, and then they just continue saying they don't know, do you just repeat the question?
What?
When you ask them that question and then they just continue saying, well, I don't know, this side hurts and then my neck and my low back still hurts, and they can't give you a direct question, do you just repeat the question again?
Do you remember me talking about resistances?
Yeah, but you need at least 2 resistance.
Do you ever remember me talking about resistances?
Yes, you mentioned that if you pass this first resistance, you'll increase the likelihood 50%.
Second resistance, not the first.
Second resistance, right?
If you go to the second resistance, you'll increase your response 50%. Then go to the third resistance. So let's say they say 2, this and that. You ask the question, which one's bothering you most? You'd like to get pain-free fast. They go, well, they both are. What am I going to do? I'm going to go to the second resistance. If you had to choose one versus the other, which one's bothering you the most? You'd like to get back to pain-free the fastest. They go, well, they kind of both are. Now, I understand they both are, but if you had to choose one, which one would it be? That's what it would sound like. And then shut the hell up. And I got one. Now, if you get to the third resistance and they're still giving you 2, what does that tell you, Matthew?
They need to be trained.
What?
They need to be trained.
No.
That they have low awareness.
Third resistance? They have low awareness if they're on the third resistance? You're in the third resistance. How high is the awareness if you're on the third resistance?
It's pretty high.
You're sky high. So if you're sky high and you're on the third resistance, what does that tell you about what the person's saying?
They're both very important.
It's true. They are both important, and it's true. That's what it tells you. So by the time you get to the third resistance, you'll have cleared it off. But if they're still sticking with it on the third resistance, it's true. They're both hurting the same. Does that now make sense?
Yes, it does.
That's interpreting resistances. Okay, so we're on ADLs. Let's see if we clean up the ADLs, see if we get the number 1 ADL, see if we quantify it. Let's see if we get the plane of motion.
Get some kind of adjustment or something done. I know I used to go to Dr. Davidson, but this is like for my lower back.
This is bullshit. He's just taking off on you again.
And he would like pop my neck, but I can't do that today. No way. Yeah.
Okay. Well, that concludes the consultation. We'll move into the examination where I'm going to assess the range of motion, muscle strength, okay,
Yeah.
and your nerves, and we're going to do some orthopedic testing for your joints to narrow down what your problem is. Okay. I will be putting your body in a few different maneuvers, so if it's a little tender or a little too painful, let me know.
Okay.
So I can take it easy. All right, we have
Okay, Matt, that was an excellent transition statement. That could not have been better. That was, you totally told him what was going on and what you were going to do and how it was going to happen. That was excellent communication, Matt. That's what you need to be doing for everything. You need to be communicating like that for every topic, Matt. Now, what do we not know? We don't know which ADL is most important to him. You didn't do a summary. You didn't find out which ADL is most important, and then you didn't do the summary. Remember, what's the number one reason you want to do a summary after you've got all the data? What's the number one reason?
To confirm you have all the information, or to show them that you understand what they just told you.
Understand? Is that the right word? The number one reason you want to do the summary is because what's the number one reason patients will fire the doctor? The number one reason patients are dissatisfied and will fire the doctor. What's the number one reason?
Poor active listening skills.
Yeah, they feel you're not listening. And how fragile is this relationship right now, Matt?
Very fragile.
Very fragile. You think it might be important to give him the inference that you're listening, You think that might be important?
Yes,
At this point in the relationship, in the very beginning, you think that might be important?
yes.
Yes. That's the number one reason you want to do the summary. It tells them you're listening. I'm telling you, patients love it. When you do a summary, patients love it. If you went to a doctor, you went anywhere else, and it's very rare that it happens. Every now and then, this just happened to me the other day, and I can't think of where it happened. But I told him the problem. It wasn't healthcare, it was something else. I don't know if it was my car or whatever. I told him the problem, and then when I was done, he goes, let me understand that I have all this. So you want me to check this, and this. Is that right? Is there anything else here you want me to check? It was fantastic. I know what it was. I was getting some work done on my motorcycle. It was fantastic. When he said, so let me understand this. You want me to check this. Is there anything else you want me to check? You know how that made me feel? It made me feel great. He's listening to me. He's right on top of it. That's what that does. Write it down, Matt. Do the summary. So that's what all it would sound like is, let me just review exactly what we covered. Make sure I'm not missing anything. If I am, let me know, okay? So you said you're having neck pain, a scale of 0 to, it's a 10, it's rating to the arm. You notice it every day, it's more constant. You noticed it about a week ago and you don't remember how it started. Does that sound about right? They love it. And it's new in the relationship. That alone could save your ass. That alone could save your ass from them firing you on day one because you screwed up in other areas. That alone could do it. Okay, so we don't know the number one ADL, do we, Matt?
No, we don't.
The single most important thing we need to know in day one, we don't know. The number one reason he's paying you, we don't know. Does that sound like good service?
No, not at all. And and I asked him too, and then he just completely went left, and then I just continued to just move from the examination to the.
So when people go left on you, you should just totally cave and give up, right?
No. No, I should ask the question again.
You are aware he's paying you to be the authority. You are aware of this, aren't you?
I am.
He goes left, what do you do?
I ask him again.
You stop him from going left and you bring him back and you get your damn answer. Who's in control in this room, Matt?
I am.
Well, why don't you step up to the plate and show it? You get my point?
Yes, Doc.
You're the boss, Matt. Step up. They're paying for you to be the boss. They're not paying just to go in there and ramble everywhere and walk out of there. Matt, if let's say something happened to your car and you don't know what it is and you went into the mechanic and he didn't even identify the main problem, how do you feel about that?
Wasted my time.
You didn't identify the number one thing that he wanted to know. Remember, the chief complaint and the ADL, they're not paying you for symptoms. They're paying you because those symptoms are stopping them from doing activities of daily living that are important to them. That's why they're paying you. You got to get to the ADL. You need to know the symptoms, but you've got to get to the ADL. That's what they buy.
Have you sit right here, Jimmy, face this way?
I was gonna go with one of those massage places, one of those Asian massage.
By the way, that consultation was just under 6 minutes. Compare that to, do you remember how long it took you prior to have that written down, Matt?
Yeah, each consultation was about 20 minutes, maybe even
Right.
push 30.
Look how much that helped you having that pre-written down and pre-filled out.
Saved a lot of time.
A ton. And a lot of mistakes. You didn't make a lot of mistakes because you were, it's called forced discipline. You knew you had to follow what's on the chart there.
Or something, but yeah, usually those guys are pretty rough. I don't think I can handle it.
Okay. Now, Matt, you already know how the consultation went with this guy and he took off on you left and right. You're going to have to train him. You already know what he's going to do as you're doing the exam. He's going to keep taking off on you.
Okay, let's go ahead and just begin. Let me see you go chin to check as far as you can go. Oh, right here. Is that as far as you can go?
Yeah.
I'm going to push a little nudge. Okay, I want to stop because your facial was already clean.
So I can feel it. I mean, it's kind of like, you know,
See? You did one test, Matt, and he's taking off on you. And guess how many tests you got to do? Can you let him take off on you like this for every damn test you do?
No, I can't.
You're going to be in there till midnight, Matt. You've got to train him. You got to shut him up. We just want yeses and nos. I don't want your damn life story.
Yeah, as far as training the patient, is that what you mentioned earlier about saying, hey, I want to get specific with the answers so we can find your problem? Or how would you train them again?
Well, when you train them, what you're doing is you're telling them that you're doing something specific and you need specific answers.
Okay.
So that's when you're training them. That's the sense. So in this particular case, what you would do is just stop and say, now I'm going to go through these different tests. You just let me know if you're feeling any pain or pressure, okay? We'll go through each one. And then you got to get going, Matt, because every time you pause, you're giving him an opportunity to take off, and he's the kind of person that's going to take off on you. So you got to move. Any pressure here, any pressure here, any pressure here, any pressure. Can you do this then? But he needs to be trained right now. Let's go through all the tests. You just let me know if you're having any pain or not, okay? And then move. Get moving, Matt. Get moving. Get moving. Talk, tell. Get moving.
Yeah, so that's a grade 3. Grade 3 is very, very bad. Grade 0, everything.
yeah, I can feel it right here.
Okay, then have you look up to the ceiling point as far as you can go. Okay, and just as far as you can go there. Okay, see, so that I'm saying that's a grade 2.
Wait, Matt, way too damn slow. way too damn slow. And you don't need to be explaining him what the damn grades are. Just totally eliminate that. You just do the test. Is that positive pressure? Not good, not good. Positive, positive, positive. In your mind, just go, don't explain to him the damn grades, Matt. He doesn't need to know the damn grading system. This is going way too slow. And I tell you, if you could go back into your file and watch Chad Faulkner's talk-tell exam, you need to listen to his talk-tell exam. He moves. He's moving. You're going unbelievably slow, and then you're stopping. It should be fluid motion. You should just keep moving. Keep moving. Positive, yes or no. Positive, yes or no. Positive, yes or no. Keep moving. Don't stop. And don't tell him the damn grade scale. You don't need to know the damn grade scale. That's for you. You write it down. You just need to know if it's positive or not, and then you know how to grade it. But this isn't moving. You're stopping. And man, he's taking advantage of every time you stop.
Let me have you bend right to the ear. Yep, bend from any pen restriction.
I can. It doesn't hurt as much, but I can do it. Right there.
That's a great feat too.
Matt, can you see how you're stopping after every maneuver?
Yes, I can.
You can't do that. It's got to be fluid motion. Just do it. Yes or no. Do it. Yes or no. Do it. Yes or no. Don't fucking stop. You're stopping to write down in your computer, aren't you, Matt?
No, Doc.
Okay, because you should be able to get through the exam with short-term memory. Remember, are most of the tests going to be positive, Matt?
No.
So how many tests are you really going to have to remember?
A handful.
Come on. Tell me we can't remember a handful. And most of them are just going to be positive or negative, right?
Right.
Tell me we can't just remember a handful of tests that are going to be positive or negative.
We have to look down again. Bend this way. Great washers on a couple of bands. Bend and look down for me.
Way too much time. Way too much time.
Not on my head. Like right there.
And then he takes off on you again because you're pausing.
Okay, let me have you look up. Good, and bend this way again. Okay, that's a grade 3. That's great.
Man, you've got to ask any pain there, any pain there, any pain there. Just do the maneuver, any pain there, any pain there, any pain there, any pain there, any pain there. And if he keeps talking on and then stop and try and say, listen, when I do a maneuver, what I'm looking for is if you're having pain or no pain, okay? That's what we're looking for. That's how I would have trained him. And then get going, get on your damn horse.
Let me have you look up again, bend this way. Anything there?
It's a little bit.
So that's grade 1. Okay, let me go ahead and see your arms and have you raise up as far as you can go. Okay, back down, raise them back out outwards. Okay, very good. Let me have you go back as far as you can. Okay, range of motion looks good. Let me test your muscle strength. Let me have your arms come up this way. Hold down, push, hold. Okay, this way. Hold. Okay, and we have your elbows to your ribs. I'm going to push down and up. Don't let me. And push down. Very good. And push up. Push. Very good.
Hey, Matt, that's real good. Look how you're controlling him and moving him verbally. That's night and day what we're hearing now versus what you did in range of motion. You're controlling the hell out of him verbally and physically. Push, hold, push, hold. See, that's how your range of motion should have sounded. Fluid motion. Boom, pain, any pressure, any pain, any pressure, any pain. That's not good. No pressure, any pain, any pressure. Just fluid motion. Engage, fluid motion, engage, fluid motion, engage.
That was normal. Push, push, push. Very good. That's normal. Push up. Normal. A little weak. Okay, let's check your reflexes.
See, look how quickly you got through the muscle test because that was fluid motion, Matt. Matt, can you see the difference between how smooth you went through the muscles test versus the range of motion?
Yes, Doc. Yeah, I saw the difference.
The range of motion, you stopped every damn time. When you tested his muscles, it was like, that was exactly how it should have been done. Move, move, move. Pressure, hold, 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 hold. Okay, hold, hold, hold. And then, Matt, the last thing, remember, it's a talk tell exam. What does that mean? If something's positive, say it. If it's negative, say it. You should be saying the results, not the functional capacity scale, Matt. So that's positive, that's negative, that's positive, that's negative, that's negative, that's good, that's negative, that's good, that's negative, that's good, that's positive, that's not good. That's what it should sound like. It's called a talk tell exam. Tell them the results as you find them without stopping. That's positive. That's not good. Back, back, back. Any pressure? No, that's good. Okay, good. No. Left, left. No, any pressure? No. Okay, that's good. Right? Any pressure? Yeah, just a little. That's not good. So mainly forward and to the right. Okay. Say it as you're doing it. Say the results as you're doing it and keep moving and stop telling them the functional capacity grading scale.
Normal there. Normal there. Normal. Okay. Normal there.
Okay, now you are. That's good. Now you are telling them if it's normal or not.
That's how. Okay, reflexes are good.
Very good, Matt. Very good. That's how you move through it. That's what that active range of motion should have sounded like.
Checking brain and continuing. Okay, so this is gonna feel like this is what it looks like. You feel that? Okay, good. Close your eyes.
Matt, you're communicating really good right now. You're talking as you're doing it. This is night and day difference than 2 weeks ago. I never even heard you 2 weeks ago. So now you're telling him what you're doing as he's doing it. And you're moving. This is exactly how the exam should sound with every category of the examination.
Okay, are you able to feel this? Does it feel the same on both sides? Okay. Same thing here, and here. Okay, able to feel that both ways. Okay, good. Can you feel this on both sides here? Yes.
See, you're moving him good. See, you're not, Matt, you're not giving him a chance to talk because you're moving.
Does that feel the same? Okay, nothing feels different right here. It feels the same. Okay, good. Open up your eyes. Okay, dermatomes, nerves looked good. Reflexes were good. Okay.
Okay, good. And say it as you're doing it. If it's good, say it. Bad, you know that. If it's bad, positive, say it. If it's good, normal, say it.
Okay. Here, push away, down and away. Any numbness, feeling in the shoulders. Anything in the shoulder, elbow, wrist? Okay. And let's hold. It's good. Let's check this side. I'm going to push you down and away. Anything. Discomfort from the ceiling, shoulder, wrist, elbow. Anything here in the shoulder, wrist, elbow.
Very good, Matt. You said it one time. He didn't respond. What did you do? You said it again. You went to the second resistance, and boom, it forced him to give the answer.
Okay. Just here, right here. Okay. All right. Okay. So, let me just take a moment and share with you what's going on.
Okay. So now you're getting ready to deliver the single most question, the number one question they want answered on day one. What's my problem? And immediately followed up with, can you help?
Going on with your neck. Okay. So what you're experiencing is you're having a significant amount of joint pressure in your neck. We know that because whenever we kind of ventured forward and towards it, we kind of opened up that gap and we put some pressure that felt good, right? But when we compressed the joint, when we had you look back and into it, it was completely like restricted. Okay, so that's how we know it's significant amount of joint pressure there. Okay. So what we need to do is we need to take some x-rays to see on the inside what we can't see from the outside. Right? That makes sense.
That was really good, man. This is Matt. This is really good. This is textbook, and it's good because you memorized it, Matt. You memorize these phrases. That's why it's going so well right now. And he is following you now, Matt. You're not chasing him anymore. He's now following you. Why is he following you? Because you took the lead and you moved. You got moving. That's what shut him up and got him to follow you. So the relationship has totally changed right now. He's now following you.
That's good. Okay, good. So what we're going to do is we're going to start the process of relieving this pain and inflammation in your neck so you get some good sleep tonight. And then Jimmy, after that, I'll get you to the front to get you scheduled for tomorrow. We're going to send you out to go get those x-rays. And then I'll be able to work more with you tomorrow depending on what those x-rays show. Okay. Also, I want you to ice tonight. Okay. Let me go ahead and get your x-ray orders ready.
Okay, Matt, just be careful. How many topics did you just cover without getting an agreement? You just covered like 4 topics without getting an okay or an agreement. That's when you're going to get your ass kicked. So remember, after the diagnosis, you should have said, does that make sense? You didn't get him to acknowledge the diagnosis. And then from there, it goes, looks like we'll definitely be able to help you, okay? And then you go into the x-rays. We'll take the x-ray line was great. He just followed right along. Does that make sense? And that's the word you want to use. Does that make sense? And then you went from there to the ice pack without any engagement. You totally changed topics with no engagement. That's when you lose people and you don't even know you lose them. Why does he need to use an ice pack, Matt? He doesn't fucking know because you didn't tell him. You got to tell him. What? Why?
Yeah, I also, listening to it again, I actually realized that I didn't say that, hey, we can help you.
Right.
I didn't say that. I just went straight for the x-ray line. Yeah.
It's a hell of a lot better than what we've saw, Matt. I will tell you that. This is a hell of a lot better. I can tell you've put a lot of effort into this. This is not the shit we heard 2 weeks ago. That 2 weeks ago, it was pure shit. This was pretty good besides you had a rough start by letting him just take off on you. But you jumped in and took control with this exam. He's leading you. Yeah, you should have just remember to break up and get that engagement in there to make sure they're with you. Does that, especially after the diagnosis, we'll definitely be able to help you.
Yeah, that makes sense. And I didn't know how to train people, or without saying like, "Hey, shut up, let's do what I want to say." So I would use that phrase that you were telling me about. Hey, I want to get specific with what I'm looking for, and I need specific answers.
Yeah, that'll save you a lot. Let's hear how this ends up.
No.
Yeah, like at work.
Remember, when a patient talks, your mind should go to one of 3 things, right? You remember one of the 3 things your mind should go to when a patient talks?
Majors, minors, and curiosity.
Is it major, minor, or bullshit? Is it major, minor, or just curiosity, bullshit? So he started talking, because remember, you don't respond like everything they say is gold. Okay, but you better damn well know if they say a major, because you don't handle the major, they fire you. And what's a major? Need, time, or money. Need, time, or money. That's a major. And then what's a minor? Those are typically the clinical questions. And then there's the curiosity bullshit questions. Well, he just asked you a minor. He just said, should I use a hot pack? So that was a minor. Now you should explain why. The difference, because he doesn't know the difference between a hot pack and a cold pack and what the reasoning is behind any of it right now.
for a little bit.
Okay, just give me one moment.
Okay. And then you bought time. You didn't just turn away from them like you used to do. So, okay, let me get 1 minute. And then now you can go and put it in the computer. But Matt, you should be talking out loud. You should be talking out loud as you're entering it into the computer, positive this, but whatever, well, the data you're putting in, you should be saying it out loud so they can hear it. Now, also, we still haven't done patient education. So let's see what happens here. See, Matt, you need to talk out loud. You need to say what the hell you're inputting out loud. Just like when you do a soap note, you have the pay, you're done with the treatment, okay? Then you go, okay, hold just a second, let me get this for your notes. And then turn to your notes and say the medical stuff out loud. Why? It increases value.
Yes, right here I was writing the X-ray orders.
Okay. I'd still say it out loud, Matt. Anything clinically, say it out loud because it increases the value.
Okay, Doc.
I'd say it. All right, let's go ahead and write you down for prescription. We're going to order the x-rays. Let me just write down the x-ray prescription here. We're going to do a Davis series, whatever it is. Say it, say the clinical out loud so they can hear you on purpose. It also will get them, when you do that, it'll also stop them from start talking. Okay, so after we do this, the very last thing we still have to cover patient education. And then the last thing we have to do, even though you told him what's going to happen, we got to tell him exactly what's going to happen from this point, every station they're going to go to until they come back and see us tomorrow. It's got to be crystal clear what's going to happen at each point until we see them tomorrow. That's how this needs to end.
Here are your orders. Okay, I use Avalon because I have an agreement with them that all my patients get priority. In and out within 20 to 30 minutes, flat fee of $100 for all the necessary x-rays for your care. I'll get the results sent directly to my computer. Okay.
Very good. That was very good, Matt. You covered the money and time. You covered the two obstacles, money, time, and he got to see how quickly he said, okay, everything's fine.
They're walk-ins, so you can walk right on in today, open from 8 to 5. Okay. Here is a piece of paper explaining how I want you to use IVE.
Matt, you just want to make sure you let them know that we're going to send you right from here straight down to there. You do not want him thinking that he can go down there later in the day. You need to tell him. So we're going to send you straight from here, straight down there, and they'll get you right in.
Okay, I'll do that.
Don't give the idea that they can go to McDonald's and do whatever and then go down there and get their x-rays. You just created an opportunity for them to leave, to not come back.
At home. So what you do is grab a towel, you're going to damp it. You're just going to damp it right here. Damp it, throw some ice in there, wrap it, put it directly over where it hurts for about 20 minutes. Would you be able to do that at least once from the
Yeah.
Okay. Let me share with you how you're.
Okay, Matt, you didn't tell him why. That was good instructions on how to use the ice pack, but you didn't tell them why. Everybody has to know why. Why? Why does he have to use the ice pack? Why does he not want to use the hot pack? Everybody has to know why.
Your neck is going to heal throughout this process, okay? So let's go ahead and talk about that. So, Jimmy, your neck is going to heal in 3 phases of healing. It's going to go through the inflammation, repair, and the remodel phases. Right now, you're in this inflammation stage. Okay, so the goal of the therapy is to decrease this pain and inflammation as quickly as possible. That's why we're going to use the muscle stem here in the office to act as a nerve block to decrease that pain. And equally important for you to use the ice at home to also decrease that pain signal that's going on, to slow it down, and to constrict those blood vessels to decrease that swelling. Okay, very good.
Matt, that was excellent. That was excellent, Matt.
So what we're going to do now is we're going to start to...
Matt, he's eating out of your hand right now. What a difference when you took control and you let it. What a difference where he's at right now versus the first 5 minutes of this relationship. You are in total control right now. He's following you. That's what happens when you do all these things in the order that you're supposed to do them. They get right in line.
Therapy, get you scheduled up at the front for tomorrow, sit you up for the x-rays, and I'll be able to work more with you tomorrow to what those x-rays show. Okay, and also don't forget ice. Yeah. Okay, so let me go ahead and have you on yourself face down.
Now, how do we know that he's with you? Well, listen to his words. How affirmative were his words, Matt? Was there any hesitation in his words?
No, there was no hesitation. He just said, "Okay, like let's go, let's do it."
No, there was no hesitation. It was total, affirmed, sharp words. Okay, see, what's that tell you? He's right
on board.
He's right with you. That's what it tells you. He's right with you. Why is he right with you? Because you let him, control him, and you gave and you nailed all the information in the order that they wanted, consciously and subconsciously. That's why he's with you. That's why he's following you right now. This is the way it should be. You're the leader. You're the authoritative one. He's paying you to be the leader and the authoritative one and to lead him. And you're just, it's all reverse engineering. You're leading him exactly the way he wants to be led, consciously and subconsciously. And you'd answered all his questions in the order that he wanted them to be answered, subconsciously. That's why he's following you right now.
Start.
Okay, so you're doing therapy, and then you should get out of the room. Remember, Matt, he's in the room.
Yes, I get out.
Get out of that room. You do not want to get caught up in small talk because that decreases your value. So get out of that room. Don't let him engage in small talk. Don't you do that. And then when you finish, when you come back, you need to restate everything. So remember, what we'll do is from here, we'll make the appointment for tomorrow, and then we'll send you right down to get the x-rays taken. Remember that they'll get you right in. It should take no more than 20 minutes. And then they'll send the x-rays back. And then we'll see you, make sure you use the ice pack. So just chronologically in your mind, just follow the steps. So make sure you use the ice pack tomorrow, or at least once by tonight. That'll help again with the decrease the pain and inflammation. And then we'll see you tomorrow. And I'll be able to work with you more after I get a chance to look at the x-rays, okay? So it's the last reminder. So when they're off therapy, you got to remind them again of all the steps. But so far, this is going really good right now.
I don't want to stop. I don't want to stop.
Okay, so you're just putting him on therapy. So we're not going to hear him when he gets off therapy. But Matt, I got to tell you, Matt, congratulations to you. You put a lot of time and effort in to get to where you had shit 2 to 3 weeks ago. And now you're controlling the patient. This is exactly how you're going to build your practice, Matt.